My committee is a standing committee on gender equality, health and social welfare. Its mandate is to exercise parliamentary oversight on activities and programs of offices. It can be ministries and agencies, state enterprises, including Ministry of Health and Social Services, Ministry of Works, Transport and National Planning Commission, among others. I'm having 24 members, but now as it is recess time, we have divided ourselves into different committees. The others are now in the other regions. So I'm now with Honorable Kandrodo, Honorable Tuliki, and myself, the chairperson. The main objective of the parliamentary committee to come to here is for the oversight, to scrutinize whether the government policies, programs and projects have been implemented and whether they are having the desired impact. We want to have service to our people, and if we don't implement what we are preaching, it shall not work. So why we came here to inquire, to monitor what is happening around us. So the committee is here for a good purpose. My take on this session was that they were not aware of the projects which we brought to them. We wanted to hear about the renovations or the projects which was budgeted by the Parliament, and they were not aware of anything, but the problems, what they are having, is what was in the capital project. They wanted renovation of X-ray, they wanted renovation of theater, they wanted renovation of the roof, but that was also the purpose why we came here. We have thought of it was already implemented, but it was not. So we will go back and report back, and soon I hope that this shall be through their ministry back, and then the renovation will take place. But more, their complaint is like there is no one coming this side. They are isolated as they are very far. So, but with what we are going to report to Parliament, I think more recommendations will be done, and then implementation shall take place, and hope that they will attend to those problems. Hope the ministry will come and see it by herself. It was also more about transport, more about smaller things like fire extinguishers. Those were something funny for them to wait for years not to have that. A laundry machine, they have to travel to Keetmanshoop to do their laundry there, but it's not good. I think those smaller things should be attended to so that we can finally not waste money for transport, fuel, and so on. In the shortage of the human resource, the minister have budgeted for this in the last budget. So I hope that with this, they are also included into. Maybe it's a matter of implementation, but I don't know how far it is, but it's also good that they have mentioned so that we can also report back and then ask the minister whether they can help these people who are crying about the shortage of human resource. Committee is given the power to handle gender equality, health and social welfare. So with them is that they as a committee set and decide on matters surrounding problems which people are having, or about the capital projects and so on. And then they go out as an oversight, inquire, monitor, and then bring it back to the committee, and then later report back to Parliament for consideration, and then the recommendations will be implemented by the Prime Minister's office to the different offices. So for now, we have gathered information from here, so we'll go back as a committee, sit, and then later to Parliament, and then to the different ministries through our Secretary of Parliament. We have done with Lüderitz. From here we will go to House, and then we'll go to Keetmanshoop, Beershepa, then Hardap region, different clinics and hospitals, and then to Hardap, Omaheke region.